And hello everyone, welcome to our first coagulation meeting. And so we're lucky to have Wendy here who will be talking about coagulation. So hello Wendy.
Hi, we're going to talk
Welcome.
about coagulation and some of the diseases associated with it, and then some medications.
Thank you very much. And Lisa's here.
Yeah, thanks for setting this up.
Great.
Anxious about this.
Thank you very much. Okay, so Wendy, please go ahead and start. Thank you.
All right. So I think that when we start talking about coagulation and the different things, that when we start talking about blood, I think it's good, first of all, to be very clear about what you're talking about. So I'd like to start with a couple of terms. First of all, when we talk about coagulation, we're talking about the factors, our so-called coagulation factors. Now, when we talk about agglutination, we're talking about the attachment of antibodies to antigens. And then when we talk about aggregation, we're talking about platelets. And so there's different tests to test each one of those things. Those are all a little bit different.
Okay.
So coagulation, we test those factors, our clotting factors. We use PT, PTT, and INR.
And just, I don't know a lot about this, but I was trying to read up on this before this meeting. And so the PTT would be the intrinsic pathway, and the PT is the intrinsic. Is that right?
PTT is intrinsic and PT is extrinsic. That's correct.
And let's see what I remember. So I was trying to remember. So PTT would be associated with heparin, and PT with warfarin.
That's correct.
Okay. Well, I've learned a little bit.
Good job.
Thank you, Picmonic.
All right. Let's see. Okay. So agglutination, those are our D-dimer and Coombs tests. And aggregation are when we talk about platelets, so that would be our bleeding time. So I have a question to pose to you. Where are our clotting factors made?
The liver makes everything except the 1 milligram factor and 8.
Good. Perfect. Perfect answer. Okay,
Where,
so that's really important.
I'm sorry, where are von Willebrand and 8 made?
At the platelets and the endothelial cells.
Okay,
Okay,
so
thank you.
they're made in the endothelial cells, so that's
Okay.
important to know. Well, I'll go through a diagram about it, but that's important to know because if the liver starts having problems, or if you want to know if there's a liver problem, you can check the factors, and you can kind of see where those factors are. But you need to know that if you check, for example, factor 8, that's not going to tell you that's not going to be a great one to choose to see if the liver is indeed having problems. So that's important to know. And then the other one is what is direct Coombs and what is indirect Coombs test. Anybody know?
No.
No. Okay, so direct is direct. It's the when you actually have antibodies directly against, usually it's red blood cells that you're taking out. Let's see if I can give you a proper definition. So when do we do Coombs test?
Lisa's got a big book.
Oh, we got the books coming out.
Well, Always good to have an encyclopedia of the medical terms.
There you
Okay,
go.
so Coombs is the test for hemolytic anemia.
Good.
Okay.
Okay, so direct Coombs is when a antibody, an
Globulin?
anti-globulin antibody is added to the patient's red blood cells, and then you check to see if they agglutinate, so if they stick together.
It detects antibodies against red blood cells
Right,
that
so
are present.
basically they take the red blood cells and then they wash them off, so there's nothing else there, they just have the red blood cells, and then they add an antibody and see if that antibody attaches to the red blood cell. And if it attaches, then the other red blood cells will stick to each other.
Mm-hmm.
Does that make sense?
I have here it says the indirect Coombs test is used in prenatal testing of pregnant women and in testing prior to a blood transfusion. It detects.
Yes.
Okay.
So that's one of your big times. So when we do when we tell people to take blood to type and cross check, it involves a Coombs test. Okay. And so indirect Coombs test is taking normal red blood cells added to the patient's serum to see if the serum has anti-red blood cell um, antibodies on the surface for surface immunoglobulin.
Mm-hmm.
So
It
it's
can also tell you if complement is present.
yes,
It's antibodies or complement.
right. So basically, one sees is it right there, and then the other one actually adds other red blood cells to see if that attaches to other red blood cells. So one's directly, you like, is there an antigen and an antibody does direct? That's your direct. You're like, here's the here's the red cell. Is there actually an antigen there to make the antibody get all excited and agglutinate, right? The other one is you put in red blood cells, you put in this, and then it's an indirect way of going about it.
So
Hence the name.
what is the difference between the term agglutinate versus aggregate?
So if we look back on our thing, so agglutinate is when antibodies and antigens are sticking together.
Okay.
Do you see that on my slide?
Mm-hmm.
Yes, I do now.
Versus
aggregate is talking.
Aggregate is
To
the clumping
collect.
of platelets
Mhm.
itself.
Okay.
Okay? Alright. And then I want to start with our coagulation. So I learned our clotting factors by the rule of tens. It is now currently an outdated model because we don't have a factor 3. So, well, it's still there, but we realize that it's not real.
Oh, I
It's
thought
not.
that they just changed the name to something else.
No, factor 3 is actually the activated factor 7.
Yeah.
So actually, I should have switched them at least so that you had 7. 7 is activated to 3, but we don't have that in any of the others. So they just got rid of 3. But you can still remember it this way, and then just know that 3 is activated 7. So here's a rule of tens. So first you start it with the word 10, T-E-N. And then and that's one side. And then the other side you have 7 and 3. Of course, they make 10.
So
And
where does it say 10?
So can you see my cursor?
Yeah, rule of tens. Oh, I see. Oh, I see 10 there. Okay.
Can you see my cursor when I?
Yes. Yeah.
show?
Okay. I
Okay.
see what you're saying.
So
Yeah.
great. So you have TEN, and then you have 3 and 7. Like I said, it should be
Okay.
switched because
Got it.
7 activates into 3, but that's okay. And it goes to 10.
Right.
And then if you look down below, you have 5, 2, and 1. And if you multiply those together, you get 10.
And that's the common pathway. Okay.
Right? Yeah, that's the common pathway. That's correct. So the 10 TEN, so T for 12, E for 11, and N for 9. Those are your factors. Factors 12, 11, and 9. And then basically you only have 7 over here, but for the sake of keeping in the tens, I'm throwing on the 3. And then 10, because it's a rule of tens, 10 is your rate limiting factor. It's the big deal. It's really important. I just realized that I want to draw. Let's see. I'm going to do something a little bit different.
So literally antibodies cross-link with an antigen.
Yes. So just a moment here. I am. Jesse had suggested that I try Sketchbook, so I'm actually going to pull it up and see if I can get it so I can draw on it.
You can draw on Microsoft Paint too. Sketchbook is a free program?
Yes, it was.
Oh.
I was very excited
I'm going
about
to try it.
I apologize for the.
No problem. We're thinking about coagulation.
Okay. It's not going to let me, unfortunately. Sorry about this. Okay. Well, I tried. Okay. So. See if I can flip this up again. Okay. Okay. So first of all, rule of tens, right? So and then because it's rule of tens, 10 is a rate limiting factor. It's the big, most important factor. It's what slows down the clotting factors. If there's a lot, you can see more. You can see the pathway being used more. It's a very important factor. Okay. So let's talk about a little bit about intrinsic and extrinsic. So let's do the extrinsic first. It's the one on the right side. Extrinsic pathway. So my mnemonic is during the war they wept. So war is for warfarin. It happened, and I have 1792 because it's, like 1492 Columbus sailed the ocean blue. Well, so this is 1792. Um, it's the clotting factors. So this is 7, 9, 2, and 10. Those are the clotting factors. So it's actually 10 there. So you kind of have to know that. And it was short but cruel. So this is protein S and C.
Good. Okay.
All right. Okay, and so war again is for warfarin, and then you have they wept, and so E is for extrinsic, so warfarin, extrinsic. PT for the wept that's how you test. For extrinsic, the extrinsic you test for PT.
And is that the one
And
that
then,
changes hospital to hospital?
Yes. So and so what do we use because that changes so much?
INR.
INR. Okay.
Yeah. Exactly.
What's the trauma then?
So trauma is the most likely way for it to get excited, for it to be used. That's the most likely way for you to activate the extrinsic. Hence it being called the extrinsic. So it's activated extrinsically to your body. Does that make sense?
No, I see.
Okay. And then so we have that. And then so in the war there's no fresh food, so meaning that they don't get enough vitamins, right? So warfarin or these factors, and then in order there are actually 2, 7, 9, and 10 in CS. Those are vitamin K dependent.
Mm-hmm.
Which ones are vitamin K dependent?
The
10.
the ones in this 19 there or 1792.
Okay.
10, 7, 9, and 2.
Okay.
Those are the vitamin K dependent. Okay. So if we go over to the other side, we have the intrinsic pathway. So that means that it's activated intrinsically. In other words, it's activated from our internal self. Okay. And so the medication that we think of is heparin. That's the one that it affects. And so heparin actually, and
Subindothelial collagen.
I want to make sure I have that right.
So what is the part that says, "Hooray, we're in college"? What does that
So
mean?
yeah, so I haven't gotten there yet.
Oh, okay.
Yeah, I'm working my way down. But I wanted to point out that heparin affects specifically factors 2 and 10. Um, it actually affects more than that, but that's what they have in your book. So that's what I was looking it up for. Um, it actually affects quite a few more than that, but we'll leave it at that. 2 and 10 are important ones. Those are kind of important ones, so we'll leave it at that. But it actually affects several of them.
And this is the type of thing we'll be discussing in a heme system.
Right. Well, these are all important because you
I'm
need
in
to
it
know.
right, and we're not. So
These are all important because when they start talking about factors, you need to know which side. So, for example, if I'm having a trouble with factor 11, say, I need to know whether it's the PTT or the PT that's going to be affected. That's why it's important.
Mm-hmm.
Okay, so my mnemonic for the intrinsic pathway is hip hip hooray, we're in college. So HIT is the actual mnemonic, H is for heparin, I is for intrinsic, PTT is for the test that it's affected, and then college is because it's activated by subendothelial collagen.
Mm.
So college, collagen, that's the thought behind it. So when I created this, I thought I was going to be able to actually draw, and unfortunately, it doesn't seem to be. I don't seem to be able to draw. Um, and I'm not exactly sure why I can't, but apparently I can't. So what is not written here is that factor 8 enhances factor 9 activity.
You can draw in a Hangout, by the way. Sorry to interrupt. You can draw in a Hangout with the Paint application, just for future. You can actually draw on the screen as you're talking.
Okay, where?
On the left-hand side, there's a choice of the apps you can put in, and it says like one is called Draw.
Oh, but I need to put it in. Oh no, it's here.
Mm-hmm.
Right?
Yeah. You could give it a whirl.
Okay.
It's kind of fun. You can actually draw within a box or all over the screen. There should be a pencil mark.
So oh, I see. Okay. So the question is, if I go to my question, can I draw here? No. Okay. So it won't let me draw. I have to draw within the
box.
Within the box. I can't draw.
Oh, okay. All right.
Elsewhere.
We'll work on that.
Yes, that's something that I need to figure out.
Mm-hmm.
Okay. So there should be an 8 right beside the 9, the little arrow going to. So I had hopefully was going to be able to draw an arrow. So and this is an activation cascade, right? So 12 gets activated by endothelial collagen, and that activates 11, and 11 then activates 9. So you see that cascade going down, right? Okay, so 8 enhances the effects of 9. Okay?
Okay.
All right.
Never going to forget that now, you know. This is a great thing about
Okay,
this.
so,
Yeah.
and then the other thing that you need to know is, first of all the factors have names. Now, having said that, you really only need to know 3 of them. Well, sort of 4 of them. So, factor 2, the unactivated factor. So when it's just hanging out in the blood, not activated, it's prothrombin. And then once factor 5 activates factor 2, it becomes thrombin.
Mm-hmm.
So that's important to know. Right? And then the activated 2, or thrombin, then, so factor 1 unactivated is fibrogen.
Mm-hmm.
So then the activated 2, which is thrombin, activates fibrogen to become fib fibrin monomers. Okay.
So
This is
prothrombin
where,
activates thrombin, and then you have fibrinogen to fibrin.
that's correct. Okay,
Then
and so that's where your aggregation happens,
mm-hmm.
right there. Okay.
10, 5, 2, 1.
And then you have factor 4, which is actually calcium. So we saw that it was a factor, but we didn't realize that at the time it was actually calcium. So we no longer actually call it factor 4, but just for future reference, factor 4 is calcium.
Mm-hmm.
So both calcium and factor 13 help stabilize and make the fibrin mesh stronger.
Mm-hmm. So what might be a typical question regarding this pathway?
So I have quite a few. So we'll go
Okay.
through them.
By the way,
Yes.
we have a 10-minute countdown, and this might be coagulation hangout number 1.
Okay. Do you want me to go through a couple of questions
Sure.
now, or do you want
Sure.
me to go through the next? Well, I think the next one I had also hoped to draw on as
Okay.
well. It's actually the actual coagulation. So this is our platelet that we have here, and then this is all the different pieces of it. So
Great.
for example, the green is our von Willebrand factor. So we can talk about how the platelet plug actually happens
Yeah.
next time.
Okay.
So why don't we come
That'd be
up
fun. We'll collect more people.
why don't we come up then with a question? I have several of them. I haven't been able to go through. Okay, so there's a couple of things I guess we should go through.
So where was 8 in that diagram?
Well, I had hoped that I could draw 8. So
Oh.
8 should be out here beside 9.
Okay, all right.
Not actually in the pathway, but it then activates or enhances 9.
Okay, thanks.
It's like you'll never forget that, right? Because you saw it on this hangout. This is great. It's a great way
So
to learn.
one thing I want to talk about is that I want to talk about protein C and protein S. So protein C and protein S are actually work to inhibit this process.
Protein
So
C, protein
these
S.
are coagulation factors, and they actually inhibit. So factor C actually inhibits factor 8, and factor S inhibits factor 5.
How do you remember those?
I draw them in And so I have my, C over here, and I have my S here, so it looks like, um, um,
Okay.
so I have C, 8, and S kind of in that order on this whole side. And again, I apologize. I thought that I would be able to draw um, through here.
I wonder.
That'll be something that I'll work on for you.
I wonder if the person who opens the Hangout is the only one who can draw.
Um,
Like if I try
well,
to draw now, like if I draw the C, can you see the C? If I draw that letter, can you see C?
I do not
No.
see
Okay.
anything.
All right.
Yeah,
Okay, we'll work on that another time.
yeah, we'll have to work on that one. Okay. Um, so the other thing that you need to know is that um, some of these work. So basically, the these factors, if you um, these factors work towards clot formation, right?
Mm-hmm.
So then you have a couple of things that work against clot formation. So you have to have this balance, right? So you can't have it going too strong, otherwise we clot everywhere, right? We need to be very focused and very, very almost delicate, if you will. Okay, so we have um, both uh, factor 10 and 2 actually prevent clot formation. So they um, they're actually they're kind of a break, if you will, in the clotting
10 and
in
2?
your uh-huh. And then I'm sorry. Wait. It's 10 and 2. What did I tell you? Sorry, 10 and 2. Oh, heparin affects 10 and 2. I apologize. That's what
Yeah.
10 and 2 is. Heparin affects 10 and 2. So heparin actually activates antithrombin, and antithrombin then decreases the action of active 10 and 2.
Okay.
Okay. So, and then what I want to say is that 5, if you, for example, if you have a decrease or a deficiency in 5, it actually leads to clot formation.
That's
So normally,
that factor 5 Leiden.
factor 5 Leiden, yep, deficiency. Exactly. So most of these factors, if you think of it, it's clotting factor. So if you have a deficiency, you would think that you would actually bleed. But if you have a deficiency of 5, you actually clot.
Mm-hmm.
And the same goes for protein C and S. If you have a deficiency in protein C and S, you're actually going to be more towards the clotting side than the bleeding side.
Yeah.
Okay. So let's see if I can. Can you guys see these questions?
Not yet.
No.
Still on the first slide.
Go on first slide. Okay. Let's see.
We got 5 minutes left.
Yeah. Okay. Let's see if I can. Okay. Can you see that?
Yes.
Okay. So let's look at 22 right now.
Okay.
So
Great.
here's an example of what it might look like.
Mm-hmm.
So Simon, you want to read that?
Sure. A 34-year-old woman who has had no prenatal care comes to the emergency department at 30 weeks gestation because of contractions and a loss of fluid. She delivers an apparently healthy girl 4 hours later. The medical student cuts the umbilical cord and places the placenta in. While examining the neonate, the pediatricians become concerned because of uncontrolled bleeding from the umbilical stump. This finding suggests a deficiency of which of the following coagulation factors?
Actually, this is something you just gotta know. Maybe this wasn't a good one to pick.
Is that von Willebrand's?
So, one of the things we need to talk about is what platelet bleeding looks like versus factor bleeding looks
Okay.
like. This one's actually one of those ones that you just kind of know.
Platelet bleeding is the kind that is going to affect the mucous membranes.
Good.
And nosebleed and easy bruising. Is that right?
Good, yes. So platelet bleeding is exactly mucous membrane. So this is your gum bleeding, nose bleeds, that sort of thing. And then you're likely to get petechiae. That's another one. Where clotting factors, that's bleeding into, actual tissue. So they usually talk about getting blood in the joints. So they had some sort of interaction, and now they have
hemarthrosis, or they could have a hematoma. Or is that right?
That's right. Good.
Okay.
Very good.
That's when it goes into the tissue.
Good, right. So this is your quote-unquote tissue bleeding, right?
So this is where somebody has hemophilia, which is factor VIII. Or that's
right.
hemophilia A, but then there's hemophilia B that's factor IX, right?
Hemophilia, yes, that's correct. Hemophilia B is the Christmas disease.
Like Christmas time, Christmas 9.
Mm-hmm.
Yeah, something like that.
Okay, we're at 2 minutes.
So factor A is factor 8, and there's actually a hemophilia C.
Oh, okay.
Yeah, it's actually factor 11.
What was the answer here?
So let's talk about that. This is actually a difficult one, and I don't know if.
Okay.
Yeah. So.
We better get the answer and then end this one and go to the next one.
We have 1 minute. Yeah.
To wrap up.
Sorry.
Yeah. Why don't we? So, and it actually takes some time to talk about it. So why don't we stop here and we'll talk about this question later.
Oh, it's a cliffhanger. Okay. Okay. And coagulation too. All right. So thank you very much for this first coagulation meeting. It's very interesting. I've learned so much. I'm sure I'm going to remember a lot of it just because we were doing it live. And I imagine people who are watching it also will get the same out of it. And so here's the question, the cliffhanger. I said von Willebrand's factor, which is probably wrong, so it'll be interesting to see what the answer is. I'll probably look at it and try and figure it out. So
there you go. You can go look it up and
yeah.
tell me what the right answer is.
Yeah. So let's look forward to the next coagulation meeting.
All right, and I'll see if I can make it sure that I can draw next time.
Okay.
All right.
Thank you very much, and we'll see you again soon.
Okay, see you again soon.
Okay, bye.
Bye.
Bye, Lisa.